my name is Dr. Haque. I am a family medicine physician in Pennacook, New Hampshire with Concord Hospital, and this is my clinic. Our clinic takes care of roughly 8,000 to 10,000 people in this community, and we serve as a traditional primary care setting in family medicine from birth to death, and we have patients of all ages and often multi-generational families. My experience with Wellsheet is primarily in the outpatient setting. In my experience so far, I think Wellsheet has been absolutely transformative to offer a point-and-care tool for timing with patients in the office, expanded really my opportunity to quickly arrive to a view of the chronicity of medical care over a timeline. And really, thirdly, the other option here that has been much more of an impact than I thought it would be is the mobile application to get to a clinical decision with another care provider on the phone quickly when you're on call after hours. So one of the important reflections that I've had with using the medical record pre and post implementation of Wellsheet was really the longitudinal view. It is very challenging as an outpatient provider to understand the narrative of time for a patient when the medical record doesn't support that view in a way that is palatable for not only myself as the clinical provider, but to share with the patient. And Wellsheet really offers this in a way that is meaningful and easy to view. Wellsheet is organized in a way in the ambulatory setting where you can navigate the existing chart data through tabs that have chronic disease management in organized settings, where each tab will give you a view of the relevant clinical data. So the patient care piece is really important here, because when you're thinking about how to distill or interpret the clinical data with a patient in the room, that is very challenging if there's not a visual that can help navigate that narrative together. Wellsheet offers that view in the timeline. So the view of Wellsheet for all the clinical data describes it across a period of time for each of the clinical disease states. So when I'm sitting in a room with a patient, I often will pull up Wellsheet to show them and explore that narrative together. One example, hemoglobin A1C. So when I have a patient who has diabetes, that is one of the proxy measurements most commonly used for clinical management. And in viewing that clinical data, I often will pull up Wellsheet, click on the diabetes tab, and navigate through the timeline of medications, A1C, and weight. And discover together, was there a relationship that took place in that timeline over the last year, over the last 3 years, over the last 7 years? Basically, when you're thinking about the chronicity of care for mental health as related to our work in primary care, it can be a really challenging landscape to navigate. Because Wellsheet has the chronic care management tabs that are in the view, you can easily navigate to the tab to see, well, in the case of my patient who has PTSD, often there are underlying and comorbid conditions that exist, like depression and anxiety. Because Wellsheet organizes all of the medications and clinical views by chronic disease management, someone who has PTSD, we can also address the other underlying components of their care, like depression and anxiety, pair this with medication, and pair this with the clinical notes to understand the care continuum over time for someone with something like PTSD. In terms of training to get onboarded onto Wellsheet is probably 10 minutes or less. It's a very user-friendly tool. The interface is very self-explanatory, and I'd say that was really the case for both the mobile application, the desktop application, and the integrated EMR application as well.